introduce nicely to Laura McHugh, and Laura is our National Breastfeeding Coordinator. Laura is the lead for the delivery of the HSE's National Breastfeeding Action Plan, driving actions across 5 work streams, and they include improving health service structures to support breastfeeding, improving staffing, resources for breastfeeding support within maternity services, and primary care, supporting education and training for healthcare professionals, implementing breastfeeding campaigns, and collection and monitoring of breastfeeding indicators and rates. So Laura, you're very busy. Thank you for joining us today.
Thanks everyone. And what a lineup to follow. And at times like this, I wish I was still frontline, but we all have different jobs, and I am very privileged to be in the job I'm in, but it's really heartening to hear about all the great work that's going on and highlighting the issues that we all know that need further action. So what I briefly kind of want to touch on here today, I suppose, is kind of some of the progress on some of the actions in the National Breastfeeding Action Plan. The action plan is from 2016, 2021, and that will be extended until at least 2022. So I suppose this year in particularly, breastfeeding thankfully has had an awful lot of airtime. We'll see a lot more talk about it politically, through press pieces and also within our own services. And I do believe we are at a point where we are kind of really moving to more hopeful space, where the foundations of the core breastfeeding supports that we need in terms of supporting mothers to breastfeed for as long as they wish are being recognized. And there is like a really true listening to the feedback of mothers through the National Maternity Experience Survey and through recent work done through Banya Baha, a recent alignment of kind of our National Breastfeeding Action Policy, the model of care for obesity. And then we have seen some serious investments in lactation consultant supports announced through the Women and Infants Health Programme last year, and then significantly with the Minister's announcement of funding this year. So it is a good year, for us, and that will bring lots of opportunities in terms of really providing family-focused breastfeeding supports. COVID, thankfully, we're coming out the other end of it in terms of hopefully the worst of it being over. And it's really positive that we have our resumption of our in-person breastfeeding supports, and really want to pay tribute to all of our HSE colleagues, and particularly our voluntary breastfeeding organisations, Lillet League and Cuidiú in particular, who adapted so quickly and moved their breastfeeding supports online, and who have been very consistent and accessible to mothers in our community since March 20. We have about 70 groups running online every month, and I know there's been loads of WhatsApp groups and one-to-one phone calls and in-person visits, and particularly our HSE services have continued to see mothers online. So COVID has brought a lot of challenges, and people have really stepped up to the mark and making sure that where possible, breastfeeding supports have really come into have remained. We've also seen this week at least 4 of the counties this week following the work of Limerick and Tala in Northern Ireland in terms of expanding We're Breastfeeding Friendly, a really positive community welcoming, normalising breastfeeding in the community. We've seen significant staffing issues and restriction within HSE services, and that has really impacted on people's experience of giving birth and breastfeeding support in the last 18 months. And again, it's to acknowledge that and to really, I suppose, it's been, really, I suppose, difficult for some staff and some mothers. And as we go back to resuming some of our services, we really, I suppose, have to kind of, consider about what the mother's needs are and what parents want, from our services. We obviously, because consistent, sharing of stories around inconsistent and conflicting information, and really, because there's been a lot of conversation about the role of lactation consultants, midwives, and public health nurses, and some confusion around that. So we really want to, I suppose, emphasize the primary role of nurses and midwives and lactation consultants then in providing expert breastfeeding support. There's increased complexity and medicalization of births, which all have an increased impact in terms of the need for really skilled breastfeeding support. And we have a range of breastfeeding initiation rates. And I gave a figure earlier on this week of 41%, but that is incorrect. I have revisited that and looked at that in terms of the initiation rates. Our supplementation rate, it isn't great, but it's not as bad as I gave earlier on the week. So it is 35% of babies whose first feed is breast milk have formula at some point in the hospital. That means they may have given up breastfeeding or received a breastfeeding or a formula supplement during their stay. So I'm just going to, I suppose, briefly go through some of the areas within the action plan and highlighting progress, that we have to date. So there are 31 actions in the breastfeeding action plan. 2/3 of them are well underway. As I said, the plan is going to be extended until 2022. So the first area I want to touch on is the really, I suppose, around the core foundations for supporting breastfeeding and for the investment and funding. So up to 2020, the National Breastfeeding Action Plan was didn't receive any additional funding apart from the work that support we would have got through the Nurture program. So in 2020, the National Women and Infants Health Program funded 3 lactation posts, and then again this year, through the National Maternity Strategy and the Women and Infants Health Program, there was an additional investment of 7.5 posts. So that was very welcome, and that really saw that every maternity hospital would have at least 1 lactation consultant post. So that was very important. And then the Women and Infants Health Program also funding 2 very important implementation lead posts, which really will, I suppose, really try and drive practices within hospital through the Baby Friendly Initiative and through the National Standardised Antenatal Education Standards. There's also been an appointment this year of the clinical lead for child health, public health appointed, which is a really important strategic post within public health to, kind of advocate and to promote all of the various pieces around child health, and particularly to that are relevant to breastfeeding. Then we know the Minister for Health announced 24 lactation consultant posts in April in this year, and that is in addition to the Women and Infants Health Programme funding. So that will see a significant increase in lactation consultant posts, where we will have some lactation consultant hours in every public health nursing area, and then larger maternity units will have greater access to lactation consultants proportionate to the births in that hospital. Currently, we have 30% of public health nursing areas have some lactation consultant supports available, and that thankfully will increase to every area will have access to free lactation consultants, which are really important posts, again, for providing expert help for mothers that need it, and also to support staff training. So the next piece I wanted to just kind of do a piece on it. The people here will know that we are looking at developing a national standardized breastfeeding training program, and work is well underway with that. So I'm in a position, I suppose, to share some of our thoughts in terms of how this national standardized training program will work for nurses and midwives. The Nurture program have funded this work over the last while, and it's really, I suppose, a blended program, maximizing the opportunities through online learning, but really focusing on the teaching of skills and communication to our mothers in a sensitive way, and really practicing and demonstrating our goals. I was really struck by Regina there in terms of her piece about how we communicate with parents, and that is certainly a really strong emphasis, not just teaching the technical skills, but really important about how we communicate, engage with our parents around teaching these breastfeeding skills. So there's going to be 4 parts to the revised training program. The first part is will be the completion of e-learning modules. There's currently 2 breastfeeding e-learning modules there. Mina, in the Assistant National Breastfeeding Coordinator role, has worked with the lactation consultants who work in the community and the hospital in terms of looking at all of the learning outcomes, performance indicators, and really looking at to see where the opportunities are for embedding further knowledge pieces into the breastfeeding training program. And there are opportunities for expanding these breastfeeding modules, and those modules will be expanded from 2 until 3, and also there will be a requirement to complete a module on formula feeding. Public health nurses here will know the 7 nutrition modules already there, and one of them is in relation to formula feeding. So we really want to make sure that the whole package of nutrition modules and these breastfeeding modules are taken on board in terms of the breastfeeding training program. There will be I suppose a part 2 in terms of preparation for attending an in-classroom skills-based training, and there will be further close videos, demonstration guides, and kind of self-assessment sheets, people to think about their own skills and where they would like further support with before they come into the classroom. Then in the classroom-based teaching, it will be of a strong focus on demonstrating and communicating and practicing these skills with each other, and really focusing on safe skin-to-skin contact, newborn behaviours, really looking at all the different situations around positioning and attachment, and then a strong focus on teaching hand expression skills to mothers, demonstrating and teaching hand expression skills to mothers. The fourth part of the training will consider, I suppose, people's practice and give people opportunity to practice these skills. And this was always, I suppose, a part of breastfeeding training, but maybe not formalized in terms of the expectation of delivering the training. So certainly we are putting some consideration into supporting our midwives and our public health nurses to practice these skills and to spend time with parents, and then to really kind of look at their own competency of these skills. And we will be putting, I suppose, supports in place in terms of train the trainers and looking at building capacity across the country and across CHOs and maternity services to deliver this training. The other key piece about the training is that there will be an expectation that this will be, I suppose, jointly attended and delivered within our midwifery and public health nursing services. That we really see a core part of these revised breastfeeding posts, where they are going to be integrated across hospitals and communities, that there will be much more integrated working in terms of follow-up and antenatal support for parents with our lactation consultants. And then that will be equally, I suppose, expected in terms of how we train our staff as well. Just as another point in regards to training, you may have been aware, and we can certainly send around a link to this, the National Medicines Information Centre sent around a revised, updated guidance on breastfeeding bulletin yesterday. They also will be having an e-learning module available for physicians and pharmacists on that before Christmas as well. We're also, as well, at the early stages of looking at maybe a proposal to work with the ICGP in terms of GP training training also. So the next part I just wanted to give a brief update is in terms of the policies and guidelines that we have developed in 2021. So the breastfeeding policy for health services staff was launched in February. Really kind of pleased to say that that policy is being embedded. We are getting lots of feedback from staff about how it might work, but really we haven't received any resistance to it. Managers are appreciating the guidance in terms of how that actually could work from them, and certainly our staff members that are approaching us feel that they feel more confident in terms of looking to ask for these breaks, because there is formal guidance in place for managers, and for staff in terms of how these breaks could work. The second policy, really important, and we will be kind of beginning the implementation of this, and we will be kind of having another webinar on this on the 3rd of November. We'll be circulating details of that very shortly. We have just launched the HSE policy on the marketing of breast milk substitutes, which is effective from October, an accompanying guide for staff in terms of considerations for themselves to think about how we promote breastfeeding, how we don't undermine it, and how we can protect ourselves from conflicts of interest, and more importantly, to eliminate the marketing of breast milk substitutes across the health services and within our staff as well. So really important, I suppose, in terms of the staff responsibilities in this area, and that we need to kind of push for implementation, call out breaches, and really be strong leaders that we don't need the industry involvement. We have numerous HSE sources of information and kind of procedures for how we will source this information, and there is no need for marketing or for marketing opportunities within the health services. The third piece, I suppose, really important around the kind of guidance for in-person groups, which is effective of 20 September, which has allowed some groups to reopen, but we really look forward to the resumption of in-person breastfeeding support groups with our voluntary groups and HSE groups, probably towards the end of October, in reality, because of venues and kind of, some of the more kind of public health guidance measures around distancing and mask wearing or that. So it's been 18 months since a lot of our groups met, so there certainly will be a period of transition in terms of having volunteers by their nature as well, that there will be lots of maybe changes in circumstance, and that, so kind of building capacity and building kind of reach again across the country will be will take some time. We will be updating contact details on mychild.ie, and the process for that will be a little bit more easier now. So we will look forward to, I suppose, kind of as more groups come back into meeting in person, that we will circulate those details on mychild. Also really important, we've learned an awful lot, I suppose, over the last 18 months about what parents want and what parents need access and how they want to access our services. And certainly the online breastfeeding support piece is going to be a core part of what parents want in terms of their the service going forward. Our own Ask the Expert lactation consultant service, available 7 days a week, live chat Monday to Friday, 10 to 3. So a 38% increase in activity during COVID, when as a direct result of in-person supports being being cancelled. But also, I suppose it's just all of the services are, are telling us that, online is going to remain, and the parents are really, really valuing that. So the next part, I suppose, I wanted to update you on the policy is about kind of really a lot of the work that's ongoing by the wider child health team. And it's really important to acknowledge that while I am kind of the person here today, there is an awful lot of people behind the scenes supporting child health work through our grant aid agreements with our voluntary breastfeeding organisations. We have a significant team on My Child in terms of web developers, content experts. Mina works as Assistant National Breastfeeding Coordinator, Women and Infants Health Programme, and the wider National Healthy Childhood Programme team. So a lot of the kind of the background supports in terms of our publications and our online support is really down to the management of the whole My Child campaign, which is a really important resource. That there's a quite a significant reach of the My Child campaign in terms of our website and our publications, receiving 3.5 million visits in 2020. All of the new parents receive the My Pregnancy and My Child 0 to 2 booklets. Our Breastfeeding Good Start in Life booklet was updated last year, and Regina alluded to that the Premature Baby booklet was updated this year. So this year in particular, we'll see 100 extra My Child guides added to the website, so there'll be much more detailed content on child health, and a number of those are going to be in relation to breastfeeding. We're also piloting 2 online closed Facebook groups, similar to what you might know of a closed Facebook group, to really, I suppose, test and to see what kind of support what additional support that can provide to mothers in terms of postnatal support. There is pockets of very good work being done in terms of working with traveller support groups around the country, particularly in the Midlands and in the West, and more recently with Pavy Point in terms of updating some of the mychild.ie booklets specifically for travellers. Also, there will be a once-off training equipment support package coming to hospitals and community services. This is really to utilise all of the Department of Health funding that has been allocated this year to ensure that we spend the money that's been allocated to lactation consultant posts this year while we wait for some of those posts to be recruited. So that will see, I suppose, investment in some cots, pumps, training materials, mannequins, hand expression, models, all the various supports that will help our lactation consultants in their training roles, and help midwives in terms of the postnatal support for maybe some others who need some additional help, maybe with after cesarean sections of that. The last piece I suppose just wanted to kind of focus on is our research, monitoring and evaluation. So like I said, we have quite recent feedback from parents through our National Maternity Experience Survey, and obviously through the National Maternity Strategy for a long number of years, and a lot of the feedback hasn't changed, and that's really, I suppose, important for us to know that why that's another need for really the significant resourcing, because the plan hasn't been resourced. That that the feedback hasn't changed; it's still the same. Lots of mums are saying that they need additional help, and they didn't get the help when they needed it. So all of the recent, I suppose, feedback from parents through the National Maternity Experience Survey and the Banya Baha survey has really, I suppose, helped us with our bid to the department, which we have sent in for a number of years, to actually see that get accepted this year. Also then in terms of the practices, we've had very positive engagement with all the maternity services in terms of completing a national infant feeding audit, and all of the services, I suppose, really consider the findings from that audit, with 22 indicators, interviews with 243 mothers, and there's lots of learning there in terms of all the pieces, the various pieces from antenatal to postnatal services that we need to see improvements on. And as the baby friendly initiatives rolls further out, audit obviously will be a really key feature of the implementation of that. So then just, I suppose, the last piece about, where we are. So we know more mothers are breastfeeding every year. So it's slowly improving. Our initiation rate, which is a new metric available to the HSE on a national basis. So that was first started to be collected in 2019. So we've 2 years data now. So that shows that the initiation rate at the minute is 62.3%. And there's a significant range across the country from 47 to 71% there. exclusive breastfeeding on discharge is 36.7, and our non-exclusive and exclusive discharge rate at 58 is 58.5%, and that is slight down a couple of percent from 2019. So wondering maybe has COVID had an impact on that. The second metric, or the third time point that we are recording breastfeeding information currently at, is breastfeeding at 3 months, and that has shown, I suppose, a 7% increase in breastfeeding rates from 2015 to 2019, where it shows that currently about 42% of mothers are breastfeeding at 3 months. So that is a very, I suppose, that is a very, short whistle stop tour in terms of what we are. So the next year will be really important in terms of us embedding those core foundations of lactation consultant support across the maternity and community services. And we're really, I suppose, will enjoy working with all of you that are working in hospitals and maternity service, or in public health nursing services to do that. So thank you, Denise, and to Gillian, for the opportunity today to speak with you.